Today on the 50 Shades of Pain show, we're going to teach you about low back pain and what your symptoms might actually be under the surface.
Welcome to the 50 Shades of Pain show, where we empower our community with knowledge about pain, both physical and emotional, to give you the tools that you need to take control of your own health. Hi, I'm Dr. Danish, Medical Director of Wellward here in Lexington, Kentucky. I'm here with my co-host, Dr. James Escaloni, and today we are talking about the different types of back pain. Generally speaking, back pain is, people think of as just one and the same. I have sciatica, I've got low back pain, but there's actually quite a lot of variation to it. I break it into just 4 basic categories. Coming from the outside in, it's muscles and tendons, ligaments and joints, nerves, and then discs. So 4 categories. And these 4 have very different presentations.
So as we're talking about this, think about your back pain you're having and which category it might fall into. So let's talk about the first one, muscles and tendons. What's that?
Yeah, this is the most common starting point for any kind of back injury or back pain is you move in a certain way and all of a sudden your back catches and you just have this gripping pain that doesn't let go. And very often that's a muscle or a tendon that has either misfired or is adjusting some kind of change within the anatomy of the body, whether it's like a ligament giving out or a muscle coordination issue, putting one muscle group at risk. But because literally every segment of your spine is controlled by a group of muscles, it's very, very common to put yourself in a position where the leverage point on that muscle or tendon is more than what it's capable of doing. And anytime there's even a small tear within the body, there's this neurological reaction that causes the muscles and tendons to just collapse and tighten down because they're trying to protect the body from further injury. So in those situations, people will be like, I just bent over to pick up a piece of paper and all of a sudden my back caught up.
Yeah.
Those issues will typically last for a few days, linger for maybe a couple of weeks, and then completely go away. But it's a good indication that there's some weakness, muscle weakness in the body, and core strengthening would make a big difference for that individual.
Yeah, and we'll tell you a little bit more about what to do on this. If you look at our Wellward Warriors webpage, we'll teach you a lot.
Absolutely.
So, second category, ligaments.
Ligaments. So we don't think about ligaments in medical school because it's not something we're really focused on in anatomy. It's not really something people have a good understanding of what their role is, but ligaments are truly the foundation of our body's stability. Because every joint has motion to it. And what prevents the joint from moving in directions it wasn't designed to move are the ligaments. Like there's a reason my knee primarily is forward bending and flexing. There's a little bit of rotation to it, but for the most part, it's a one-directional joint. And it's one-directional by intention because I don't want my knees going outwards when I walk. And that's all helped with ligaments. Well, the same thing happens for the spine as we have ligaments that prevent the spinal segments from sliding forward, backward, side to side, and that's by intent. However, as we age, I always say, we develop skin wrinkles, your joints develop wrinkles too, and I call those joint wrinkles, meaning that the ligaments start to lose their elasticity and their strength and tensile strength, and as a result, you get a little bit of wiggle motion to it. That wiggle can put the muscles and tendons at risk, but it can also put the ligaments themselves at risk.
Oh, there's a lot of things that, again, we can do and at Wellward to be able to help you out. It's just that we are paying attention to this, whereas he said he wasn't really paying attention to that as much in school because it wasn't an emphasis.
Yeah, it was never taught. But the way you can tell you've got a ligament issue is that if every time you move in a certain position, you feel like your muscles are doing all the work and then eventually they start to fatigue and then you get this dull achiness or burning sensation in the muscles because the muscles are redundant with the ligaments. They're compensating for instability in the ligaments. People will often describe this as I'm standing at the kitchen sink, I'm brushing my teeth, I'm doing dishes, but after a few minutes, they feel like they can't continue to stand there. That's a good indication that there's a ligament dysfunction that warrants attention.
And there's a lot you can do about this too. And just remember, you're just going to feel like you're just worn out, you're a little unstable. This is a great area where rehabilitation could kick in if they're doing the right rehabilitation, which once again, we'll talk about on a future episode. So Now we're going down to the nerves, the stuff that people are scared about.
Yeah.
Nerves, nerve pain.
Most people will say, I've got sciatica, I've got a pinched nerve, I've got a slip disc, and all of these are referencing pain that maybe originates in the back, but people feel them extending into the legs. It's very common to think this is a result of a nerve being problematic, but I always remind people, if you've ever gotten a finger stuck in a door, when you pull that door open, it's not the finger that hurts, the whole hand is throbbing. I mean, you might feel it all the way to your elbow. And it's because the nerve signal coming out of the injury is so loud that at the relay centers of the spinal cord, where those signals are processed and sorted out before they're sent up to the brain, it overwhelms the system and they just can't tell where it's coming from. So it sends an alarm bell for that whole region. The same thing can happen in your spine. If you've got an injured ligament or a tendon or even a joint, that is something that could generate such a loud pain signal, you could feel it elsewhere. And that's called referred pain. Referred pain is not the same as a pinched nerve. A pinched nerve or a compressed nerve, it's usually one of two states, either an acute injury that's caused a radical change in the spine, creating a compression around the nerve. And that can feel like an all of a sudden feeling of pain in a specific nerve highway into the leg, or it's a chronic change. It's something that's evolved over time as a result of oftentimes arthritic changes because the joint swells with arthritis, or disc changes because the disc loses its stamina and it becomes squishy and bulges or herniates backwards into that nerve canal. And those things are more of a chronic evolution, meaning people feel this ongoing sensation in their leg that's worse with certain positions or certain postures, oftentimes standing and walking. We call that neurogenic claudication because there's actually congestion of blood vessels around that nerve, and it's the congestion of blood vessels that causes that sensation down the leg rather than an actual compressed nerve. So those are very treatable. There are treatment options outside of surgery for it, but it's important to tease apart nerve root pain or radicular pain from all the other categories of pain, which can mimic each other.
All right, so last category, another one that's scary for a lot of people, discs.
And I kind of lump discs and joints together because they're two sides of a tripod. Like the front leg is the disc and the back two legs are the two joints of your spine. Oftentimes they go hand in hand because you don't develop arthritis in isolation and you don't develop disc issues in isolation. They're stabilizing each other. As we age and we develop those joint wrinkles, our joints become mobile, and so that puts a stress on the disc for which it wasn't designed. Discs are great compressive springs, but they're not very good shear stress, like going forwards, backwards, side to side. So as that disc breaks down, it puts more and more pressure on the back two legs or the joints, and so they can start to become arthritic and problematic. All of these issues will feel very similar, whether it's disc pain or joint pain. You can have a very similar achiness in your back that worsens as you stand, as you walk around, if you're in stagnant positions. But teasing those things apart is really a nuanced job and very, very important to do before you commit to something life-altering like surgery or something that has a radical change in your anatomy.
And that's why it's really important that whenever you're going to see your provider, they're not just saying, oh, well, let's see your MRI. Looks like here's where the problem is on the MRI. You need surgery. I need to implant something into there. There's a lot that goes on with it. And if they're only looking at an MRI, they're just looking to find a place to do a surgery. You need to look at somebody who's going to be doing a very thorough workup to try to do the minimal amount to have the maximum outcome for you.
Yeah, because not all those changes that are showing up on the MRI are relevant. If you cut yourself and your skin scars over, that scar is a healed region of the body. It's not necessarily the reason that your hand hurts. So the same thing, if your MRI is showing changes, these might be old scars from old injuries that have since healed and no longer clinically relevant, but it puts stress on other structures, and those now may be the cause of the pain. So it's not enough to just look at an image and decide, okay, that's what needs to happen. It really does take this integrated, thorough workup to figure out what's relevant, what's not.
That's why you got to come to Wellward, and we're hoping to see all of you guys over this way so we can help you with your pain.
That's right. And join us on our future casts on Facebook, YouTube, even now Instagram, or look us up on the web at wellwardmed.com. We'd be happy to get you in and evaluate and figure out where the origin of your back pain is coming from. So for all of us here at Wellward, we wish you joy and growth on your Wellward way. I'm Dr. Donish.
I'm Dr. Escaloni.
See you soon.